Hi, thank you for joining. Today's class, they say take deep breaths, but there's so much pain and it hurts to breathe sometimes. So why? Let's talk a little bit about the why, but then also learn a little bit about how we can breathe when we have chronic pain. So one thing that they might not be considering, well, there's a few things actually. One that they might not be considering is what happened in your day before. So maybe let's say you're going to a physical therapy appointment, but you've had a horrible morning. Maybe you heard some awful news or something that really disturbed you. That can exacerbate your pain. So now you're going to physical therapy, getting ready and preparing to move your body, but that makes you also nervous and fearful. So those things compound might affect this process. And also the level of pain that you're experiencing in that moment can also have a deep effect on your breath. And then lastly, something that's really important to think about is it's actually the brain that makes our pain, not the body. And the brain isn't necessarily, I call it the overprotective parent. The brain makes pain when it is perceiving danger. Not necessarily true danger, but when there's a perception of danger. And the body is in charge of delivering messages, either messages of safety or messages of danger. So if there's messages of danger happening, the pain will increase, your nervous system will dysregulate, and it's going to be really hard to breathe. So there's a few things we need to back up with a little bit here. We need to think about how can the body send messages of safety to allow for this space to breathe or the space to move, if that's what's being asked. But let's just focus on the breath right now. So first and foremost, I want to be checking in to see even how do I feel in this moment. So when you're being asked to take some deep breaths, I invite you just to first find that seat, maybe relax the hands, lengthen the spine to create space for breath. Relax the shoulders, soften the jaw, rest the tongue, and just pause. Oftentimes when I have my clients do this, they notice, wow, I'm holding my breath. I'm not even breathing. That's almost the most common comment. The other thing is they might say, I'm taking these really short, shallow breaths right in the front of my chest. So that to me is not sending safety messages. That's saying I'm kind of on alert. One thing you might do, and I know it feels simple, but just take your hand, one hand, and just rest it onto your heart. And just apply very gentle pressure. Again, keep that lift of the spine, relax the shoulders. And just take a moment to notice how you're breathing. If it feels more comfortable to keep your eyes open, you can. Or I invite you to close your eyes and see how that feels. And we're just finding our own pace of breath. And we're letting the body know that there's safety. And then the body in turn can send those messages to the brain. Okay, this might be unusual, but I'm okay. I'm safe. Now release your hand if you have your hand on your chest and open your eyes if they're closed. And just check in to see if just even within that short little window of time, if you've noticed any difference. Sometimes there's a little bit difference of like, I can relax the body a little bit more. I've reduced a little bit of my anxiety sometimes. Whatever helps to go more into that space of safety is going to help the brain decide the level of pain. So let's try some breathing, simple breathing practices. But first, let's send some safety messages, okay? And see how that feels. So I'm just coming to a comfortable seat. And again, you can choose this with eyes open or closed. And I want you to think of something that brings you just sheer joy. It could be someone, two-legged or four-legged. It could be a place. Whatever it is, maybe it's a place you've never been. but it's on your bucket list. And you can picture it in your mind. So just give yourself a moment to center. Whatever that is, find that place, find that person, find that cute little dog or cat or whatever it is. And just imagine being with that person, that little animal, or in that beautiful place. Now, as you're picturing that, I want you to turn your attention to notice your breath. Possibly, you'll notice there's a little bit more space for breath. Just a little bit. I also want you to think about bodily tension. If you notice you're holding your shoulders close to your ears, can you allow a little bit of space for them to relax while you conjure up this image in your mind? Good. Just take your time to breathe. Now, if your eyes are closed, slowly flutter them open, come back to your space in the room, feel the feet to the floor. And we still have that image of safety, something that we can go to at any time to bring it close and help us regulate the nervous system by all those steps. Body sends messages to the brain. The brain lets the nervous system know, is it in fight, flight, or freeze, or can we relax? Okay, so if you're going to physical therapy and they say, okay, let's breathe while we do this movement, ask them for just a minute and find your center. I know it might feel weird, but whatever. If this helped to reduce your pain, then give it a try. And just say, I just want to sit and breathe for a little bit. I just want to relax. I'm going to put my hand on my heart. I'm going to close my eyes and I'm just going to think of that safety person, animal, place, whatever it is that creates that sensation of joy within my body. Okay, now the brain knows things are okay. Even though I'm going to do something that might be a little bit unnerving, I'm going to stay in the place of safety. So maybe your hands come down to your thighs. Your spine is nice and long. Relax the shoulders back and down. And allow the pelvis some space to release to the seat of the chair. And we're just going to stay focused here for 5 breaths. Just keep it simple. And as you breathe those 5 breaths, I want you to picture in your mind that idea, that person, that place of safety. Just breathing in through the nose. And you can choose to breathe out the nose or the mouth. Whatever feels best to you. Second breath, take your time. Good. Third breath. This time, possibly even a little bit more breath, expanding the rib cage or down towards the belly, whatever feels best. Relax the tension in the body as you exhale. Good. Breaths 4 and 5 on your own. See if you can slow things down. Still picturing the image in your mind. Letting the brain know we're safe. Good. And everyone's pace of breath is different, so take your time. Once you finish that 5th breath, if your eyes are closed, go ahead and flutter the eyes open and give yourself a moment just to look around the room, and then take a moment to go internal. Notice if there's any sensation within the body. Notice if you have that feeling of unrest or anxiety, or if there's possibly a little bit more space for calm, for safety. And see if you notice a difference between how you breathe once we've done this little short activity versus how you breathe when you're in your mind, thinking, perpetuating stories. It's not that the stories aren't real. They're very real. Same with your pain. But we can shift how we think, and we can shift to that space of safety, even in those moments when things don't feel very safe. We can turn internally and find that center for ourselves and remind the brain we're okay, we're safe. And then that again allows the regulation of the nervous system to happen. So I hope this practice suits you well and that you can implement it any time in your day. If you find yourself hurrying, rushing, feeling frantic, or you notice your pain increasing for what seems like no reason, see if you can find a moment to just sit by yourself. And this video is under 11 minutes right now, so it doesn't take a whole lot of time. But see if you can remember your safety, what brings you to that space. Stay in that space for just a brief moment while you're relaxing the body tension. Stay focused, your thought of your mind on that safety. Let the brain know we're okay. That can reduce or influence your pain, and it can also help you relax your nervous system. So, taking deep breaths once we've found that sense of safety is so much easier than doing it by command when someone says something. And it definitely is a lot easier once we've focused on safety. So I hope this video helps you, and please refer back to my channel for more guidance on how to move amidst the pain and finding your path to easing pain. Thank you.